Hi, we're going over Modern Dental Assisting Chapter 53, Dental Implants. So when natural teeth are lost, fixed and removable prosthodontics are there to duplicate function and appearance with crown, fixed bridge, removable partial denture, or full dentures. Dental implants have changed prosthodontics over the last few decades with the discovery of the use of titanium. A dental implant provides a natural-looking and functional replacement for missing teeth by combining the principles of fixed and removable prosthodontics with the use of a bone-anchored implants. Artificial teeth are attached to metal implants that are permanently secured in the jaw. These implants hold the artificial teeth in place as firmly as the root system holds the natural teeth. So what they do is they take these dental implants and they attach artificial teeth to anchors that are like posts that have been surgically embedded into the bone. The implantation procedure involves several steps and can take from 3 to 9 months to complete. Depending on the type of implant, the steps will vary. Most dental implant procedures are performed in the dental office, but some can require an outpatient surgical setting depending on the patient's general health and the type of implant. So the dental implants are artificial teeth, like I said, that are anchored surgically and embedded to the bone. So you have to think about that, and that we're going to have these down into the bone, and the top piece is going to be cemented or bonded to that anchor, and that is going to be the crown. They're very natural looking, and no one can tell that that is an implant, except when you take an x-ray and you can see the implant screw in place. It is an expensive treatment option, though. It is the optimal treatment option, so it is the most expensive treatment option. So the indication for implants is that they're now considered the standard of care and can last for over 20 years, and in some cases, a lifetime. A dental implant can have a success rate of greater than 90% if there is an effective home care and regular dental visits are maintained. So these are to replace one or more teeth as single units, support a bridge and eliminate the need for a partial denture, provide support for a denture, making it more comfortable, and prevent bone loss and gum recession, enhance patient confidence in smiling and speaking, and improve overall physiological health and psychological health, improve aesthetic appearance of the teeth and mouth. Contraindications, as with any dental procedure, dental implants can bring challenges. Because each patient is unique, any surgical success cannot be 100% guaranteed. So as with any dental procedure, nothing is guaranteed. We cannot simply say that it's going to work. But it does have a 90% success rate, which is pretty high as long as it is maintained properly. So the patient must be properly screened, and some patients may not be good candidates for an implant. So the following contraindications should be considered when many implant options are discussed. So the financial investment is greater. They are more costly than the other options are. Treatment can take several months to complete, where other options may take hours to weeks to complete. There is a higher risk of infection than there is with other treatments. An implant may loosen and require replacement, especially if the patient is a grinder or a bruxer. The implant procedures may be emotionally challenging for some patients because they are more complex. Bruxism, like I said, is a significant component of failed implants. So bruxism or grinding. So if the patient is a grinder, they do have to take that into consideration. And some medical conditions like bone disease or a compromised immune system could lead to failed implants. A comprehensive evaluation is essential in the determination of whether the patient will benefit from dental implants. The ideal candidate to receive an implant is in stable health, has adequate alveolar bone to hold the implant, and is willing to commit to an attentive oral hygiene and regular dental visits. During treatment planning, the dentist and the patient will discuss the patient's needs, desires, and financial commitment. After these issues and existing problems have been evaluated, the treatment is decided on. and the prosthesis that satisfies these goals is started. Specific treatment options are available for this partially and completely edentulous patient, and the prosthesis being fixed or removable depends on existing oral conditions. With a psychological evaluation takes place on the initial visit, and the dentist assesses the patient's attitude, ability to cooperate during complex procedures, and overall outlook on dental treatment. They also determine whether the patient has realistic expectations about dental implants and the end results. For the dental evaluation, the dentist evaluates the condition of the teeth and soft tissues, areas of attached and unattached tissue, and the height and width of the edentulous alveolar ridge and bone. That information is necessary for determining the best type of implant and for deciding the location in which to place the implant. They will also do a medical and dental history evaluation. That is to evaluate and assess any existing medical condition that could worsen as a result of the stress of the implant surgery. As mentioned earlier, medical and health conditions that can interfere with normal healing must be carefully evaluated. Specific conditions that could interfere with implants include diabetes and suppressed immune system and chemotherapy treatments for cancer. The specialized radiographs and imaging that they use during the planning phase and throughout the treatment to evaluate and determine the height, width, and quality of bone in the area for the implant, as well as the exact positioning of the implant, are periapical, panoramic, encephalometric, and tomographic x-rays. So the next thing are the diagnostic casts and surgical stents. A diagnostic cast is fabricated at the beginning of the appointment to construct a surgical stent. It is used as a guide or template that is positioned over the alveolar ridge to guide the proper angulation and axis for drilling into the bone and placing the implant screws at their proper position in bone. The surgical stents are typically fabricated in a dental laboratory with clear dental acrylic resin. And some dentists will use computer-aided design and computer-aided technology or CAD/CAM machines with 3D printing to construct the surgical stent, and the stent must be sterilized before use. So in preparation for the implant, we must have informed consent, which has the background information on implants, the complications of implant surgery, the prognosis of the treatment, the time frame of the treatment, what the home care instructions will be, and what the follow-up appointments will entail. For surgical preparation, the implant surgery must be completed under strict surgical sterile conditions with sterile instrumentation. The patient's mouth is rinsed with 0.1% chlorhexidine and the head is draped and a sterile surgical drape is applied to the circumoral area, leaving only the mouth exposed. With the lack of bone density, the bone density is an important component of the implant success or failure. Bone density can vary considerably on the location of the implant. For example, the density of the bone in the mandibular area is greater than that of the maxillary anterior. In a case in which there is extensive alveolar bone loss, it may be necessary to provide bone augmentation before implant placement. Bone grafts are classified based on how they produce new bone: osteoconduction, osteoinduction, or osteogenesis. You can look up these 3 types of bone grafts on your book, in your book on page 813. There are different types of dental implants. The types of dental implants there are endosteel, which is the most commonly typed of implant that is placed, and is surgically placed into the jawbone. Each implant holds 1 or more prosthetic teeth, and this type of implant is generally used for patients requiring crown, bridge, or partial and full denture. Implants and abutment screws are commonly made from the metal titanium because of its compatibility with bone and oral tissues. Titanium implants can be coated with hydroepoxy and ceramic substance that rapidly osseointegrates the implant to the bone. So osseointegration is the process by which the living cells of the jawbone naturally grow around the implanted dental supports. So they grow into the threads of the implant so that it stays stable in the jawbone. The maxillary implants or the maxillary sinus is a consideration when placing dental implants in the maxillary jaw. The floor of the maxillary sinus is close to the roots of the maxillary molar and premolar teeth. Because of this, when these teeth are extracted, there may not be adequate bone height to support dental implants in the posterior maxilla. A sinus lift or bone graft to the floor of the maxillary sinus may be indicated. Subperiosteal implant is a metal frame that is placed under the periosteum and on top of the bone. So under the layer of skin, of tissue, but on top of the bone, in contrast to an endosteel implant, a subperiosteal is not placed into the bone. It's on top of the bone. So they are indicated for patients who do not have enough alveolar ridge remaining to support the endosteel type implant. This type of implant is used most frequently to support a mandibular complete denture. 2 surgical procedures are required for this type of implant. During the first surgery, the alveolar ridge is exposed and impressions are taken of the alveolar ridge. After the impressions are taken, the tissue is repositioned over the ridge and is sutured back into place. They send that impression to the laboratory where the metal frame with its post is fabricated. After the frame has been fabricated, the second surgery is performed. The alveolar ridge again is surgically exposed and the metal frame is placed over the ridge and then is sutured into place, and the tissues are sutured over top of that metal framework. Then we have the transosteal implant. The transosteal is inserted through the inferior border of the mandible into the edentulous area. The most common type is transmandibular staple implant or fixed mandibular implant. These implants are used primarily in patients with severely resorbed bridges and only when no other options exist. With the maintenance of the dental implants, long-term maintenance is an integral part of the treatment for dental implants, and it must be conveyed to the patient during treatment planning phase. This maintenance includes home care by the patient and periodic maintenance visits to the dental office. The health of the peri-implant tissue is a critical factor in the success of the dental implants. It is similar to the gingival sulcus and surrounds the natural tooth. So we have to brush and floss around the implants just like we do our natural teeth. So the patient should have routine office visits and they should be scheduled at regular intervals for exams, radiographs, cleanings, removal if there is any removable, and the fixed components need to be cleaned. If any of the parts need to be replaced, we need to do that at the regular maintenance intervals and do any relines or remakes as recommended. For implant failure, they can fail for several reasons, and that can begin in the diagnosis stages, preparation of the site, placement of implant, and after surgery. So here listed are the specific areas that can affect the success of the implant. So when patients have fixed or removable prosthetics that do not fit properly, the dentist may recommend dental implants. The dental assistant plays an important role in implant dentistry. They must have an in-depth knowledge of the armamentarium used, how to maintain a sterile environment, and patient communication skills during the surgical implant appointment. The dental assistant must monitor both the dentist and patient's needs throughout the procedure. Thank you.